In this video, you'll get a quick overview of the egg zoomer test. I'll explain the vibrant advantage and the technology used. Then I'll walk through each section of the test, highlighting key features. I'll also suggest complementary tests and end by summarizing the key takeaways and where to go for additional information. The egg zoomer detects IgG and IgA antibodies to peptide-level antigens in egg, and also includes the level of egg white IgE and egg yolk IgE. In other words, it's a food sensitivity test assessing for reactivity at the peptide level. Peptides are short chains of amino acids, typically 2 to 50 of them, linked together by peptide bonds. Note, a chain of 51 or more amino acids is called a polypeptide. In contrast, proteins are made from one or more polypeptides folded into three-dimensional shape. These large, complex molecules play many important roles in the body, from red blood cells to enzymes to muscle cells. Food sensitivity testing measures reactivity to whole, undigested three-dimensional proteins. Since proteins exist in an aqueous, i.e., watery environment, reactivity to whole proteins is predominantly to the outer water-soluble portions of the proteins. In contrast, food zoomer testing, like the egg zoomer, measures the reactivity to small, typically not water-soluble, two-dimensional peptides created when whole proteins are digested into small fragments. Note, antibodies to peptide fragments will not recognize or bind whole three-dimensional proteins, and vice versa. To learn more, check out the peptide versus whole protein handout in your provider portal. Vibrant's egg zoomer is a blood test that can be collected via venipuncture or dried blood spot. Fasting is not required, and there are no dietary or medication restrictions. However, as with all antibody testing, patients taking steroids, immunosuppressive medications, biologic agents, or other immunomodulating medications may have falsely lower or falsely increased total and specific immunoglobulin results. More on this when we get to the complementary tests. Vibrant measures antibody levels using a proprietary microarray plus chemiluminescence. The microarray works similar to ELISA methodology. However, instead of 1 antigen per well, we can measure up to 96 antigens per well. This is possible because we attach antigens to silicone wafers and dice the wafers into tiny microchips. Then arrange the microchips, one for each antigen, in a 4x4 or 10x10 grid atop one pillar on a 96 or 24 pillar plate. The pillar plate is then submerged into the patient blood sample, allowing for the simultaneous analysis of a large number of analytes from a single sample. Finally, a high-resolution imager is used to simultaneously detect chemiluminescent signals from labeled antigen-antibody reactions at each microchip throughout the multiplex microarray. Amplified chemiluminescent signals with high signal-to-noise ratio provide high sensitivity, meaning very few false negatives. This automated process allows for high-throughput, sensitive, and specific analysis of multiple biomarkers from minimal sample volumes. Before we dive into the actual report, I want to remind you that you get to choose how much information to include in the report you download for yourself or the report you share with your patients. You have 3 options: summary, interpretation, and all markers. I'll be going over the report that includes all 3 options combined, as it is the most comprehensive. Let's start with a quick overview. The egg zoomer sample report includes a cover page, introduction, summary with interpretation, and lists all markers. The cover page identifies the sample type and includes the results interpretation key. The introduction page is where you can find the methodology and interpretation of report, and I highly recommend reading this page, especially the part where it explains how the egg zoomer summary score is calculated, using a unified score calculated from the IgE, IgA, and IgG reactivity to the respective antigens, with higher weightage for IgE than IgA than IgG. As well as the part where it says, reference ranges have been established for an adult population using 2,000 healthy individuals, and goes on to explain, a classification of green denotes result that is within the normal reference range, yellow denotes a result that is moderately elevated with respect to the reference range, and red denotes a result that is elevated with respect to the normal reference range. The summary starts with the egg white and egg yolk score. Note this patient has a moderately elevated egg white score of 3.23, but their reactivity to egg yolk is well within the reference range. The summary also lists all the elevated and moderately elevated results along with an interpretive comment. More on this in a minute. And the full report lists the levels of all markers, including egg white IgE and egg yolk IgE, And note this patient is not allergic to eggs, as well as the antigens found in egg whites such as ovomucoid and ovalbumin, and the antigens found in egg yolks like lipovitelin and vitellogenin-1. The IgA and IgG antibody levels are reported as both a number and plotted graphically so you can visually see how high or low your patient's results are. For example, this patient's level of ovomucoid IgA and IgG are both within the reference range, but their IgG is borderline moderate. If you want to learn more about markers that are outside of the reference range, you can scroll back to the summary and read the interpretive comment. For example, ovalbumin is a protein found in egg white, and it is heat-labile, meaning it breaks down at high temperatures. Hence, people who are sensitive to ovalbumin can often tolerate cooked eggs. However, make sure to look at all egg antigens because some may be heat-resistant. So, which patients benefit most from this test? Well, patients complaining of GI symptoms like gas, bloating, and abdominal pain, also difficulty breathing, headaches, skin reactions, joint pain, irritability, and nervousness. Before we talk about complementary tests, I want you to think about Dr. Sidney Baker's TAC rules. Rule number 1. If you're sitting on a TAC, it takes a lot of aspirin to make the pain go away. In other words, it's difficult to heal if you don't identify the root cause of your symptoms. Rule number 2. If you're sitting on 2 TACs, removing one does not necessarily result in a 50% improvement in symptoms. In other words, sometimes there's more than one root cause contributing to your symptoms. In addition to the egg zoomer, consider a food zoomer bundle to assess immune reactions to peptides in other commonly consumed foods, such as the corn zoomer, dairy zoomer, grain zoomer, lectin zoomer, nut zoomer, peanut zoomer, soy zoomer, and wheat zoomer. Also, the food allergy panel to assess IgE immune reactions to 12 of the most common food allergens. Note, if this test is ordered, the result will populate alongside food zoomer results. And also the gut zoomer to assess for gastrointestinal imbalances that may potentially increase the risk for food sensitivities. And finally, total immunoglobulins to evaluate baseline levels of total IgA, IgG, IgE, and IgM. Serology testing is based on normal functional immunoglobulin production. The total immunoglobulins test assesses the number of immunoglobulins, which is helpful in those with suspected immune function compromise or those undergoing IV IgG therapy. In summary, the egg zoomer uses highly specific and sensitive microarray methodology to measure IgG and IgA antibodies to egg antigens, and also includes egg white and egg yolk IgE, providing an in-depth assessment of reactivity to egg. To learn more, visit the link in the video description. If you have questions, please ask them in the comments below this video. Thanks for watching, and I hope you have a vibrant day.